spine is stiff, irritated, or overloaded, your muscles begin to guard. Your joints stop moving the way they should, and suddenly even simple activities, turning your head, getting out of your car, bending forward, become painful. That's where manual therapy comes in. Hi, I'm Denise, registered physical therapist. For more than 30 years, I've helped patients recover from neck and back injuries using one of the most effective tools we have in physiotherapy, manual therapy. Using gentle, skilled, hands-on techniques, we restore mobility in the joints. We reduce muscle tension and improve how the spine functions as a whole. There's no cracking, no rushing, just precise, controlled movement based on years of orthopedic training, including my Level 5 Manual Manipulative Therapy certification. Most people feel relief within a few sessions, but the real change happens when manual therapy is combined with the right exercises to support a better long-term function.
Manual therapy, frequently asked questions. Does manual therapy hurt?
No, most patients find it relieving. Techniques are gentle and controlled.
How long until I feel better?
Many feel improvement within 1 to 3 sessions, depending on the condition. If you've been living with neck stiffness or low back pain, especially if it's been weeks, months, or even years, there's a safe, effective path forward.